Hi everyone, welcome to the Jobskin webinar series for the compression for the lower limb. With us today is Veronica Eichmann, our clinical representative from New Zealand, as well as Rosemary Kendall, our clinical representative from WA. My name is Adam Ho, I'm the Managing Director of Jobskin, and with that I will let Rosemary kick off.
Hi everybody, thanks for joining us for this second session. It's not a part B, but it's just an alternative time session for this webinar, compression for the lower limb. Now, some of you may have joined us for some of the other webinars, and we've done a whole range of different things. This one is probably more inclusive of a range of diagnostic categories. Obviously, when we did, compression for edema and lymphoedema in the head and neck, that very specific, whereas this covers a whole range of things. So I hope this is going to be useful for you. It should be very thorough. And I do apologise if some of the information is familiar to you, but I want to assume less rather than assume more so that it's suitable for everybody. So today we're just going to review prescribing garments based on their construction. So this is before you actually get to the point of measuring and fitting a garment. We'll review precautions and contraindications, because for the lower limb kind of hits every diagnostic category. And sometimes we're putting on a garment for one therapeutic purpose, but we need to be mindful of other things that are going on. We're going to look specifically at graduated compression in the lower limb, and we've got one case study which is particularly, it's a particularly good case study where we look at the impact of the graduations of the compression. We're going to do an overview of the Jobskin measuring system for the lower limb. Some of you, this will be very familiar. We've got some very short videos just to kind of orientate you to that. Bear with us if it is familiar to you, but for those of you who are new, it should give you a very quick and easy look-see at that. We're going to cover the options and modifications for the lower limb, and we're going to look at a couple of case studies, and then very briefly at the end, just ensure that you know how to prescribe and order your garments. So why would you choose Jobskin for the lower limb? I mean, you and I both know that there is a plethora of options, particularly for lower limbs out there. Range of constructions, range of manufacturers, local, overseas, the whole bit. Jobskin is a local Australian company. Our garments are made in Melbourne. So yeah, you are supporting local Australian business, but that's not your go-to reason. Your go-to reason is finding something that is what you need for your patient. So Jobskin garments are fully customizable, and when I say fully, I mean fully. Our design team are awesome at coming up with things that are really good for your patients. You can select the compression level anywhere from 20 up to 70 millimeters of mercury, and you can vary it within a garment. So you might have one compression on one leg and a different compression on the other, or maybe some in the legs and reduced in the torso. Well, we can talk about that. We can accommodate any size, I say with absolute confidence. That means from very tiny babies through to even the super morbidly obese patient. Obviously, different challenges of measuring and prescription, and that's probably something for a rainy day to consider. But I would say we have run workshops at both the Burns Conference and the Lymphoedema Conference about working with very large people, and so there are some quite good resources on the website, a couple of lit reviews, so that might be useful for you to check out if you're interested. We can modify garments to accommodate issues or not with the skin integrity and making sure your garments are comfortable. The garments can be modified to help with donning and doffing, and we'll see that a bit in one of the other case studies. The appearance can be whatever your patient would like it to be, and if it means that a garment's more acceptable to wear, me personally as a therapist, I'm all for that, because if somebody can wear a black garment with yellow stitching and feel like nobody notices because it looks like skin's awesome, because that means they're happy to wear it out. All right, so what are the clinical indications that are suitable for Jobskin compression? Scarring and burns, definitely. Mild to moderate edema, traumatic edema, palliative care, and Jobskin actually can provide some very lovely, gentle compression options for people who have been palliated, because when edema is out of control, it can add considerably to distress and pain levels. Mild to moderate lymphoedema, we'll talk a little bit more about that. Dependent edema, so there's a whole range of edemas. But actually, you know, the origins of Jobskin garments were vascular. So, and that's never changed. So, Jobskin garments are highly suitable for CVI, for leg ulcers, for varicose veins. And garments can also be used for lipedema. I'll refer to that a little bit later. And very customizable and suitable for people on the hypermobility spectrum. Now, quick overview. This might be familiar to some of you, or maybe very new to others. But what's really important with compression to understand is that the way a garment is constructed influences your prescription, because you need to choose a garment that is constructed in a way that is the most appropriate for the therapeutic need. And these are not readily interchangeable. There's patients can move between categories, certainly, but it's not just a straight exchange. So we'll talk about the first category first, circular knit, and these are the travel sock you buy from the chemist, the medical grade compression socks that people can buy from their local pharmacy, might be provided by hospitals, but they are knitted on what looks like a giant French knitting machine. If some of you may recognise that little graphic there with a circular knit garment. So under where it says circular knit, which is the French knitting spool, which some kids used to do at school, where you have a single thread and you wrap it around the nails and hook it over. If your tension is tight, you get a skinny tube. If your tension's loose, you get a fat tube. And basically, a circular knit garment is knitted on a glorified French knitting machine. It's a single thread. So if you were to cut that garment, it would curl because of the tension that is in that thread. And the reason that is significant is that it carries a risk of tourniquet. And I saw a lady just this week who lives in an aged care facility. She'd just been prescribed and provided with a circular knit knee-high socks for lower limb edema. And she had a groove around her ankle that, I promise I'm not exaggerating, it was deeper than a centimetre. And I've actually got a photo, and I need to ask for her consent to use that image, because it absolutely shows the risk for an inappropriately prescribed circular knit garment. So then that's kind of the sort of the most simple form of lower limb garment. At the other extreme is a bit of an exaggeration, but at the other end we have flat knit garments. These are measured differently. It's not just a body measure, but because it's a combination of body measure, maximum tension, and therapeutic judgment. They are measured, they are sort of fabricated on a flat knit machine. And so they are knitted into a single piece, and then there's one seam down the back. They are a much stiffer garment. And when you have patients with lobular legs and lots of folds and creases, a flat knit is more appropriate, because it holds the shape and it molds the shape. So it reduces that lobular creasing and sort of smooths the shaping. However, I come across a lot of therapists who think that if somebody is not suitable for a circular knit garment, they have to go straight to sort of the heavy duty option of a flat knit garment. But in fact, there is this big spectrum in between there, and that space is well filled by cut and sew garments, one of which is Jobskin. So these are constructed by measurements, but comprehensive measurements being taken. The designer takes those measurements, much as sort of a tailor, making a bespoke coat. they would take your measurements and then they would design the garment to fit and sit to your preference. This is designed to sit and fit accurately to your body. And then when we're talking about lower limbs, to the lower limb. This fabric doesn't curl, but it's not super stiff. So if someone doesn't need the stiffness, this is a really good option. And in fact, sometimes flat neck garments, they're just too much for people to manage. So we can offer a lot in this space. And we'll talk a little bit more about that as we go. So next decision, when you're prescribing a garment, you've chosen your method of construction, which is going to be the most appropriate garment. So how do you decide custom made or ready to wear? Well, not ready to wear is not available for all body parts and with all sorts of options and modifications. So that's one thing. But really custom made is essential when patients don't fit ready to wear garments. It might be circumference, it might be their limb length, it might be their height, it might be their proportion. And it's not like buying a pair of jeans where, let's say, you're a size 12 on your hips and you're a size 8 on your waist. So you think, well, I reckon I could probably squeeze into a 10, be a bit tight on my hips, but maybe that's a good thing. I can use a belt on my waist and then it will be fine. It will fit everywhere. But in fact, we can't do that with medical compression because we are playing around with the level of compression and the graduation of compression. So basically, if a patient doesn't fit the sizing guidelines in ready to wear, they don't fit. So custom made's also important when a flat net is not clinically indicated, but they don't fit ready to wear. So you have a very good option before you go to sort of the heavy duty option of a flat net. It's important when a patient is an odd shape or when you need a particularly accurate fit or compression. Oftentimes when you need high levels of compression, and our case study is going to look at that. When a suitable style is not available, or just when you need to modify options and modifications. As an example, flat neck garments, the manufacturers of flat neck garments have very limited options and modifications because they know that in that style of garment, it compromises the efficacy of the garment. And so, for very good reasons, they are limited, but sometimes you need more than that. So a cut and sew garment is a really good option. Let's just quick overview of precautions and contraindications. And I suspect that this is probably familiar to all of you, but we need to review it just to be sure. And particularly as, and this is probably a little bit of a hobby horse of mine, because I think therapists, of which I'm one, who work with patients with burns and scarring, our focus is very much on providing adequate scar management. And, unless we're experienced, we kind of forget that there are other comorbidities that actually might affect their fitness for compression. I think that therapists working with edema and lymphedema primarily are a little bit more attuned to it because of the way that condition presents. But we tread carefully where there's poor cardiac function, where there is arterial insufficiency, but not to a severe point. We're not going to put heavy-duty compression where there is compromised arterial supply, so we can use lighter compression. Renal insufficiency, extreme shape distortions, lymphoria, certainly severe peripheral neuropathy, pulmonary edema, or skin or scar fragility, they all mean that we need to tread carefully or sometimes modify the garment in order to make sure that this is not a problem. The contraindications, this is a little bit less flexible. Congestive cardiac failure, we don't want significant distal compression because then we're increasing the fluid load on the heart. Severe arterial insufficiency, this is when an ABPI is under 0.5, definitely not, because then we are going to heavily compromise the blood supply to a limb. Cutaneous infections, exudative dermatitis, or in the case of burns and wounds, if they're very bulky dressings, we don't put compression on mainly because it's ineffective, because there's just too much of a padding buffer in between, and so you're not getting the benefit that you are aiming for. So let's talk a little bit about graduated compression in the lower limb, and it is helpful to have an understanding of how compression works in the body as a whole. For custom-made cut and sew garments, compression is calculated differently to, say, flat knits or even ready-to-wears because it's based on a whole body concept. When you nominate a compression, the figure that you are nominating is what is going to be applied at the ankle. And the graduation, this is helpful to know actually, is we can manipulate it based on our therapeutic purpose, and our case study is, or our first case study is going to look at that. And the levels will be can be adjusted by the designers based on age. If you have a very elderly person and you have put a very high level of compression, they will recommend that it's reduced because of their age. And just a little side note, because to explain this whole body concept I'm talking about, when you recommend 30 millimeters of mercury, unless you say you are specifically wanting that for the upper limb garment, all the graduations are consider the whole body. So the upper limb, say in a bodysuit, if you say 30 millimeters of mercury and that's what you're wanting at the ankle, that will actually be 20 millimeters of mercury in the upper limb, unless you request an alternative. Now, let's look at the principles of graduation. I just need to take a sip of water, excuse me. Okay, so when you nominate a level of compression, whatever you're prescribing your garment at, you are going to get 100% of that chosen level at the ankle. So if you prescribe a garment at 30 millimeters of mercury, at the ankle, it will be 30 millimeters of mercury. That measuring point is deemed B in the compression world. At C, which is the calf, it will have been reduced to a level that is 50 to 80% of what it is at B. So if you have a 30 millimeter mercury garment, the compression you're getting around the calf is between 15 and 24 millimeters of mercury. That means at the thigh, at F and G, it's somewhere between 6 millimeters of mercury and 18 millimeters of mercury. Obviously, 20% of 30 is where I get the 6 from. 18 millimeters is 60% of 30. So depending on what the issues you are specifically trying to address, you may actually think, oh, I'm not going to get enough compression at that level. So maybe I need to increase the distal compression, or maybe we can play with the graduation levels, which we'll talk about in that case study I've referenced. So how much compression when for the lower limb? Basic overview, 15 to 20. This is, you might sometimes hear this called a class 1 compression. This is a travel sock compression or class 1 lightweight compression, suitable for tired, aching legs, minor leg edema, minor varicosis, and that includes, varicose veins that develop during pregnancy. 20 to 30 is probably the most common class of compression, and you might hear this called class 2. My own preference as a therapist is to talk about the millimeters of mercury, because the classification systems do vary based on the country that they're manufactured. Class 3 I could be getting these the wrong way around, but a class 3 in France might be 32 to 45, Germany 30 to 45, somewhere else 28 to 35. So rather than call it a class, talk about the millimeters of mercury that you're applying. So this is used for scar management, also used for tired, aching legs, moderate to severe varicose veins, after sclerotherapy, for moderate levels of edema, and also to prevent recurrent ulceration. And then 30 to 40 millimeters of mercury, you might hear this called class 3, but this is probably the class where that can vary most significantly. Severe varicose veins, lymphatic edema, also post-sclerotherapy. This depends a bit on surgical preference. Management of venous leg ulcers, and moderate to severe edema. And a little rule of thumb that I use is, if you're relatively new to compression, let me just assure you, you don't have to make this judgment from scratch. This is a very helpful starting point guideline, but if you see someone who's got very serious lymphedema or edema, let's say, you're not going to look at that leg and go, ooh, serious swelling problem here, I'm going to have to choose 50 or 60 millimeters of mercury. It's just not a thing. We start at, so like these levels that are outlined in this table, you start with 20 to 30 or 30 to 40, And if that fails to hold, then you go up a class. You don't have to make that judgment. That's a terribly difficult position to be put in unless you're very experienced and have a very comprehensive medical history provided. So it's a normal practice that you go up a class when the previous class is failing to address the issue that you are seeking to treat. So now, how do you measure a lower limb with the Jobskin measuring system? We have a wonderful measuring system, which can be totally intimidating when you first look at the tapes, but once you've seen it used, you'll visibly sag with relief. We have purpose designed and constructed tapes that will allow you to take comprehensive measurements along the limb and take the length at the same time. If you're measuring for a below knee garment only, you're going to use the grey tape. If you're measuring a full leg, you'll need the royal blue tape or nautical blue tape. If you have stock in your clinic or your department, you probably have the old tapes because this colour has just recently changed, and the teal tape is exactly the same. If you're working with children, you'll need the pink coloured tape because that is suitable for upper and lower limbs for children. It's a slightly smaller, you can see it's a slightly lighter weight tape. Just for your information, that purple tape you see there is for upper limbs, but this shows our suite of tapes. If you are needing to take specific measurements of toes, then you use what we refer to as the hand and finger tape, which is this one here. And you'll see this used in the video. It used to be orange. You may have orange ones in your department, but as you get new stock, they will be blue. And the forms, when you're measuring for the lower limbs, you're going to use a below knee or a waist high, thigh high form. Or if you're incorporating it into a bodysuit, then the bodysuit has a separate form. Okay, I'm just going to play you 3 brief videos that will orient you to how you measure the lower limb. Let's go.
Knee-high socks and anklets are measured using the grey paper tape. However, you need to start by tracing a foot outline on the foot trace form that is included in the below knee forms. If you are measuring both feet, you will need an additional form. Unless a toe piece, a thong toe, individual toes, or an interdigital web spacer is required, it is acceptable to trace over the ends of the toes. If you are ordering an open-toed garment, mark the desired garment length. Ideally, position the patient in long leg sitting or in lying with the legs straight. Circumferential measurements are taken around the lower leg, so it is helpful to elevate the leg. Ask the patient to elevate their leg, or ask someone to hold the foot, or prop on a folded pillow. Position the tape on top along the length of the limb, taking care to ensure the distal and proximal markings are correctly orientated. Secure the solid coloured tape around the ankle, starting at the anterior ankle crease and wrapping the point of the heel. Ensure that the foot is at 90 degrees to the leg. If the patient is able to assist, you may like to ask them to anchor the proximal end of the tape. Secure the tapes around the foot, adjusting for length by pleating the spine tape if necessary. Measure the lower leg up to the knee, taking care to ensure the circumferential tapes cross the spine tape at right angles. Your aim is to get an accurate body measure, so the paper tape should be pulled slightly firmly but not tight. The skin will just indent, and it is important that it is no more than that or the garment will be too tight. It is helpful to add sticky tape to the secured measure to ensure no movement of the tapes. The coloured spine tape provides the length measurements as each circumferential tape is 3.8 centimetres apart. To determine the proximal end of the garment, consider ending the garment 1 finger width distal to the popliteal crease. This generally provides good anchorage for a knee-high sock. However, if the final tape is beyond that point, the length is adjusted by pleating the spine. This pleat should be secured with sticky tape. If you are only requiring an anklet, do not measure beyond tape 4.5. To do so would result in poor anchorage and the sock would slip down. When all the tapes have been secured, tear the circumferential tapes away from the straight edge of the spine to remove the measuring tape from the patient. Transfer the measurements and complete the form as explained in the introductory video. If individual toe measurements are needed for the required garment, refer to the foot measuring video. Knee-high socks.
We're going to go straight on to the foot measuring video.
A small number of garments require additional foot and/or toe measurements, most notably the toe piece, the interdigital web spacer, and an anklet with individual toes. The foot trace, using the foot trace form, requires that individual toes are included. Orientate the foot straight on the grid with the third toe lined up on the dotted line. If the foot is too large for the form, the foot can be angled to accommodate the length. Do not use a plain piece of paper as the grid is essential for checking measurements. Using a pen refill, mark the base of the toe web spaces, then carefully trace around each toe and the remainder of the foot. For open-toed garments, mark the required lengths against the toes before moving the foot. If a toe piece is required, the MTPs and the end of the garment should be marked on the foot trace, and these points marked on the foot to enable circumferential measurements to be taken later. Measurements are taken by sliding the tape loop over the toe and then tightening the loop when the tape is correctly positioned. The measurement is read at the tip of the arrow on the tab. As you measure, record each circumferential measurement in the corresponding box. The grey boxes on the form are all circumferential measurements, whereas the white boxes are length measures. 2 additional circumferential measurements are required for a toe piece, over the MTPs and at the end of the garment, as marked when taking the foot trace. These measurements are usually taken with the Jobskin retractable tape measure. All these measurements should be entered onto the measuring form at the time that they are taken, then the form completed as explained in the introductory video.
Okay, we're going to go to one last video. Bear with me, and we'll look at how you measure a full leg.
Lower limbs are required for all thigh-high and waist-high garments, regardless of length. These measurements are taken using the teal paper tape. However, if the foot is to be included in the garment, you need to start by tracing a foot outline on the foot trace form that is included in the thigh-high, waist-high forms. If you are measuring both feet, you will need an additional form. Both closed-toe and open-toe variations are acceptable, but it is not recommended that individual toes are incorporated into a thigh-high or waist-high length garment. Given this, it is acceptable to trace over the ends of the toes. If you are ordering an open-toed garment, mark the desired garment length on the foot trace. Ideally, position the patient in long leg sitting or in lying with the leg straight. Circumferential measurements are taken around the leg, so it is helpful to elevate the leg. Ask the patient to elevate their leg, or if someone is available to assist, ask them to hold the foot or prop the foot on a folded pillow. Alternatively, and particularly if the thighs are large or the tissue very soft, you may take these measurements in standing. Position the tape on top along the length of the limb, taking care to ensure the distal and proximal markings are correctly orientated. Secure the solid coloured tape around the heel, starting at the anterior ankle crease and wrapping the point of the heel. Ensure that the foot is at 90 degrees to the leg. If the patient is able to assist, you may like to ask them to anchor the proximal end of the tape. Secure the tapes around the foot, adjusting for length by pleating the spine tape if necessary. Measure the leg all the way to the groin, taking care to ensure the circumferential tapes cross the spine tape at right angles. Your aim is to get an accurate body measure, so the paper tape should be pulled slightly firmly but not tight. The skin will just indent, and it is important that it is no more than that, or the garment will be too tight. It is helpful to add sticky tape to the secured measure to ensure no movement of the tapes. The coloured spine tape provides the length measurements, as each circumferential tape is 3.8 centimetres apart. To determine the proximal end of a thigh-high garment, either the garment should end at the gluteal fold or at a point where the circumference slightly reduces. This generally provides good anchorage. However, if the final tape is beyond that point, the length is adjusted by pleating the spine. This pleat should be secured with sticky tape. When all the tapes have been secured, tear the circumferential tapes away from the straight edge of the spine to remove the measuring tape from the patient. Transfer the measurements and complete the form as explained in the introductory video.
Okay, thanks for bearing with us while we look at those. So what we're going to do now is we're going to look at some of the options and modifications that are available to you for lower limb garments. This is the cover and the inside of the brochure that we have called Garment Selections and Modifications. And on the there's more options and modifications on the back page, but I haven't put that up here because they don't relate to the lower limbs. So we're going to look at these in detail. But before we do that, I just want to make sure that you understand how to read the tape. If you've used our system before, of course, you'll get it. But the videos showed you how to actually use the tape, but you obviously need to take the measurements off it. There is one more video, which I decided 4 videos was just too much in one webinar. But if you go onto www.jobskin.com, and under support and training, you'll find the how-to measuring videos. There is one that's an introduction to the Jobskin measuring system, which actually shows you the same sort of information I'm going to cover now, but it's another good reference point for you. So that's what a tape looks like when you've taken it off, in this case, an upper limb. So how do you actually get the measurements off that? Well, where we are actually reading the measurements is along that blue line. And we are measuring in this direction because that's the direction that we've measured we've wrapped the tape around the limb. So we're not going to read from here going up. You must always read going down. It sounds obvious, but it's very easy when you look at the tape just to make that mistake if you're not clear about what you're trying to do. So as a close-up, can you see these thin lines between the big numbers, the circular numbers? They are the centimetres. So each of these thin lines is 2 millimetres apart. So where that arrow is pointing is at 23 plus 2 lines, so that's 23.4. On our tapes, we don't record on our forms, I should say, we don't record the decimal point, so it would just be 234. However, that's not where it crosses the straight line. I'm just showing you that that's what that particular point is. If we look here, you can see that there's 1, 2, 3 lines for after 25 where the tape crosses the straight line of the spine, so that would be 256 or 25.6. Here it would be 24.7. All right, so it's fairly, once you get a handle on it, it's very simple and straightforward. It's just a matter of sort of getting your head around it. So let's look in detail at some of the options and modifications. So what can impact garments for the lower limb? This section, vest, bodysuits and waist-high garments, that's a bit of an overview of the types of garments that are available from the section here where it says bodysuits all the way through to chap style, but we'll look at that in a little more detail as we go. And there's some additional options. We'll also look at this in a bit more detail that are available for garments that impact the lower limb. So they're the waist-high thigh-high type garments. Then we have below-knee garments, which it does look like there's a lot of feet there, but this is probably the most common one, but it's relatively small. That's a knee-length garment, and then you can have an anklet, or then some specific for toes or modifications for toes. There's the toe piece, the web space, the thong toe anklet. I'll talk about those a little bit more. And then we can vary it a bit with reinforcements and slight tweaking of movement of seams. We'll cover that in a sec. So generally, or an overview, waist-high, thigh-high garments, we have pantygirdle or bike shorts. It doesn't have to have that two-tone look to it. It can just be a single colour option. Waist-high tights that can include or exclude the feet. A waist high one leg. I would caution you with this. It's fine for a kid, but for an adult, not that comfortable, because well, we adults, when we're a little bit more fussy about how our clothing sits. And this part here has got a little bit more movement to it, but if it's purely for stabilizing this leg, for a child, it can often be a very useful option. And this waist high one leg can be a full leg or a bike short length. This one is a full length leg with a bike short option on the other side, and that's a very good stable garment, very comfortable to wear. Thigh highs can be tricky to keep up, mainly because of our shape of our legs. Even with silicone-backed elastic, they're not brilliant at staying up. So another option might be to go for a chap style, where it's got a waist anchorage around what's essentially a thigh-high garment. Again, all of these garments can be feet in, feet out. Now, there's lots of options for how you actually handle the crotch in a garment. This is specific to body brief, so it's not particularly for lower limbs, but depending on where there is that possibility to incorporate this. So a snap lock or a Velcro closure. I have to say, for adults, that's not comfortable. Okay. Certainly suitable over nappies, and depending on the child, their age and activity level, that you could consider that. A child's open crotch can be helpful when garments are slow to remove, and kids, young children are not quite as meticulous with hygiene when they go to the toilet, so an actual wider sort of bottom area can be helpful, provided that doesn't compromise why you need the compression. And for young children, a nappy strap can be incorporated into the garment to anchor it. Again, not so much for lower limbs. For adult, so pubis styles, for men, there's three options: a diagonal fly, a pouch, which provides a little bit more room, but does not have an opening like the diagonal fly. And the diagonal fly there, that's made in a softer material like a satin lycra, or it can be just a normal gusset, which will provide a bit more compression over the pubic area. And that's a standard, that gusset is standard for women. The gusset can actually have different fabric in it. It could be just a mesh fabric so that doesn't get so hot in the pubic area, or can have satin lining if that's more comfortable than pownet. Or for both men and women, there is the option for an open crotch, and sometimes that is by far the most appropriate option. But do be aware that the sides of an open crotch do have a tendency to creep down the legs if the garment isn't fitting spot on. So that few other torso extras that doesn't really just fit into the pubic areas, it really includes the reinforcement panels and the ostomy opening. So when we look at that more closely, you can have an opening for a colostomy bag, for example, built into the garment. And I actually think the best way to do this is take photos with the tape measures in place and measure from the waist of the garment to the very center of the ostomy, the opening, and then do the same from the midline. Or alternatively, fit the garment, then mark exactly where the ostomy is and ask the factory just to modify it. Uplift panel can be helpful for postural support and also for larger people. A pregnancy panel can be put into a garment, and of course suspenders are available to hold your pants up for people who, particularly if they don't really have a large waist and small hips. You can also use postural support, and this is shown in the left on a bodysuit, but you can put postural support wherever you want it to discourage or to reinforce movement. We do occasional boning in garments, but that's not our specialty. But traction panels are very helpful, and this is particularly useful for people with hypermobility, either just general hypermobility, elastase loss, or also women with lipedema. And lipedema has quite a high incidence of hypermobility as well, and it's somewhere between, the figures suggest 50 to 60%. I've got a lady who I'm seeing at the moment with lipedema. She's due for new garments, and this time, her second round of garments, we're going to reinforce the knees, and because she's started wearing knee braces, and we can actually do 2 for 1 in the garment, really. Knee reinforcements are helpful for extending the wear of a garment in a child, and you can also have reinforcements under the soles of the feet, which again extends the life of garments. So the lower limb or the below knee garments, knee length, as I mentioned, anklet, then there's toe pieces and variations on toe pieces. And a thong toe garment's helpful when you need a closed toe garment, but you want patients' preferences to wear thongs. And just a little aside, actually, I have on occasion, this is like an individual toe piece, a toe glove here, I have on occasion grouped toes. It can look a little bit funny, but sometimes from a therapeutic point of view, you get far better compression around the toes, and it's not quite as tricky to get on as a toe piece or a toe glove. Reinforcement for the sole sometimes extends the garment wear, but also actually, you know, when you have those patients who are a little bit like the princess with the pea under the 20 mattresses and she could still feel it, sometimes people are like that with the central seam that is common, is standard in the garment. So you can actually move the seams to the side for their comfort and tolerance and compliance, in fact. A couple of other options, and this includes arguably 2 options that I would say are the most common and the most useful to be aware of. First is the anterior ankle insert. The anterior ankle crease is a bit of a pitfall spot for potentials for creasing, for tourniquet, for sensitivity, where and with pockets for swelling sort of distal and proximal to the anterior ankle crease. So having a seam that goes across the front there may not be brilliant, but an anterior ankle insert basically moves the seam proximally and distally by putting in this diamond-shaped insert. It's also helpful when there's skin fragility, skin irritation, or scarring right over that anterior ankle crease, because that otherwise that seam is just like irritating on that sensitive area, whereas this, it's lined with satin lining. Actually, it just disperses that possible friction or irritation. That's the same again here. This is a garment with a self-enclosed toe, so just all power net. This one, however, has got satin lining on the end, so when people actually wouldn't really tolerate power net all the way to the end of the garment, or particularly if they've got like very wide MTPs and a narrower sort of foot, the garment has a tendency, if it's open-toed, to roll back and sort of bunch up over the arch of the foot, which is uncomfortable and unhelpful. So soft enclosed toe adds good anchorage. Sling back, that's just a little addition that can go on a toe piece just for stability. Now, one little thing, I know this is a bit weird that I've just put up pictures of 2 gloves when we're talking about the feet, but it's easier to show this on a glove because hands are generally bigger. But a standard insert is, this is what is stitched between the front and the back of the glove to make the finger or the finger part 3D. So a standard insert is just like a strip of fabric that's folded in half and it's stitched into the fingers like that. But if you look at your own hand, if you look at your hand in front of you right now, look at the palm of your hand, and you can see the height of the web space. Then turn your hand over and look how you can see how the web space actually angles down to the dorsum of the hand. Same is true of your feet between your toes. And so having the slant insert, which is a bit like an L-shaped piece of fabric, folded in half, so you see how it gets that angle there, or it can be cut as 2 strips so that it's seamed together along this bottom bit here. But can you see that that angles down, so you get a snug fit? This is particularly helpful for the potential for scarring or for pockets of edema that sit in the web spaces, because you get a nice snug fit. It is not helpful for established strong hypertrophic scarring in the web spaces, because it's a little bit like shutting the door after the horse has bolted, because in fact the glove will just sit higher up the fingers because it's not strong enough to actively push against scarring into the web spaces, but it is strong enough to deter it from happening in the first place. One thing, if you do work with patients with scarring, it's helpful to sort of highlight is that we have Cylon-Tex available, which is a silicone impregnated fabric. It's only 0.5 millimetre thick, so it doesn't add bulk to the garments. It lasts for 6 to 8 months in a garment, so it outlasts the garment most commonly. So it is a really cost-effective option. When you consider the cost of silicone gels or silicone gel sheets, Cylon-Tex is much cheaper. It's sewn into the garment, conforms beautifully, and it's great over small circumferences like toes, web spaces, and in hard to reach areas. Now, a few resources to assist you. The garment selections and modifications brochure we've had a look at. We've also got 2 great brochures that are designed to help you continue to develop in terms of your skill level with prescription. We've got one that's suitable for burns and scarring and trauma, and we've got one that is suitable for using for patients with edema or lymphedema. You can download those off the website in the support and training section, or we'd be happy to post them to you if you prefer like a hard copy that's sort of like a lightweight card rather than just photocopy paper. Now, a couple of case studies to wrap up. I think we're doing fine for time. Now, I had problems in the first webinar with my slides automatically advancing, so apologies if I skip back and forth a little bit. This first case study is a 39-year-old man. He was extremely fit and active, but he had his left inguinal nodes removed as a late teen, and he has been managing it for 20 odd years. He would describe it as settling overnight, but he has very significant refill during the day. He, as I say, he was very fit and active. He was not an elite cyclist, but not far off it. He's worn compression for the last 20 years. But when I saw him, I was asked to go and assist somebody with him actually at a store that sold ready-to-wear garments. He took off his pants, his business pants, then he took off his, waist-high garment, and then he took off his second waist-high garment, and then he took off his third waist-high garment, and finally he took off his fourth waist-high garment. So he was layering multiple garments to try and achieve adequate compression in the thigh, because that's where the problem was. So clearly that was not a reasonable long-term option. So, we've got a bit of a conundrum, because where the issue is, it's in the thigh and the groin. But if you think back to where we were talking about graduated compression, that meant that as the graduation, oh dear, it's got a life of its own at the moment. We had a problem because the where he needed the compression was proximal, but if we really amped up proximal compression, we potentially put the distal limb at risk. So the solution that we came up with is he had a 70 millimetre mercury garment, which is a very high level of compression, but he's young and fit. He's certainly able to put it on, but we minimised the graduation. So whereas, say, if it was the minimal graduation, if he'd started with 70 millimetres of mercury at his ankle, it would have reduced to 14 where he needed the compression, which is not helpful. But by minimising that graduation, working with the design team to do that, he was actually getting 40 millimetres of mercury at G, which was sufficient, and gave him a really good option. And I apologise, there isn't another image. I don't have an image of him wearing his garment, and I didn't have a garment photo that was the appropriate kind of compression. But it's basically what he had there, what you're looking at there now, but all the way down to his feet. Okay, our second case study, if you've seen any other webinars, you might have actually seen this case study before. I love this case study because it illustrates a lot of things. And this was an 86-year-old woman. And these are not uncommon presentations. An older person living alone. She had dependent edema, and the very first time I saw her, she had leaky legs. Very complex past medical history, renal insufficiency, osteoarthritis, she had bilateral carpal tunnel syndrome, frozen shoulder, she'd had traumatic injuries to both shoulders, osteoporosis, low back pain, she'd had Guillain-Barré, she had depression, she had had a left CVA but had no residual deficits. But all of those things impacted her ability to be able to put a garment on. But she had a significant issue that needed address. She was in receipt of a care package. But she clinically, when you look at the list and the fact that she had leaky legs, you think she needs a flat neck garment. But she couldn't manage a flat neck garment, and in fact, neither could her carers. There was just failing on every turn. But when you look at the shape of her legs, you think, wow, that's going to be tricky to stay up. And I apologise because when I took that photo, we'd just taken off her socks, so you can see the little dots from the silicone backed elastic. So in order to provide her solution, this is what we came up with. And she's been wearing these garments for years. That's kind of like a tried and true formula, and they're working for her. She needed zips to aid donning and doffing. However, she then needed zip fastening aids because for her, with her weakened hands and limited reach, to try and hold the two sides of the garment together was too tricky. So by pulling the Velcro tab across, that takes the pressure off. You can zip up, undo that, do the next one up, zip up. So that helped her do the zips up under tension. She had a zip looper. She chose ribbon because it laundered better than, very long life to it, better than a leather cord. And she likes to wear them like this, looped up, tucked under the band at the end of the day, so that it's out of the way. But it means that she can reach the zip when it's down at her ankle. She has the anterior ankle gusset to reduce the anterior ankle creasing for comfort. It's satin lined, but also for safety, so she doesn't get that creasing occurring. She has the soft enclosed toes for comfort, but also for anchorage. She's one of these people with wider MTPs, and so an open toe garment's going to slip back roll onto the back of the foot. She had 5 centimetre silicone backed elastic because that champagne shaped leg is difficult to retain a garment, but her garment never slips down, It's absolutely does the trick for her. So, and just to finish, I've just got one little handy hint. It's not a pressure, it's not a case study per se, but this area here behind the malleolus, is tricky to get compression, and this seems to be a common area for scarring, and you can have significant edema pockets around here. And when you put a garment on, it tenses. You can't see this in the photo, and this is just a normal foot. It's not somebody who's got either scarring or edema, but it tenses across there. So where you need the compression, you ain't getting it. So the solution to that is to some L-shaped memory foam stitched in behind and under the malleolus. And for those of you who are working with people with scarring, a good little tip here, and I've done this multiple times, is that you have that L-shaped foam stitched in, and then that is lined on the inside with the Cylon-Tex fabric. So you get silicone in a place that's really tricky to put a silicone gel sheet. You get the silicone and you get the enhanced pressure from the memory foam. So that's my little tip of the day. All right, I forgot to show that. Okay, and just to finish up, let's just talk about how you complete your prescription ordering. Every order has to have this generic order form because it's got the patient details, date of birth, address, diagnosis, your details as the therapist, And then it's got payment and delivery options, details there. And then depending on the garment that you're ordering, there's a couple of forms that you might use. So the thigh high, waist high form, I apologise, it looks intimidating, but honestly, we've been through the options and modifications. It's just a matter of scanning down the list and go, oh, yep, that's the one I want. I'll mark that one and I'll mark that one. And then here you're just selecting one. You're choosing the one garment that you want. And then the measurements are transferred from the from the tape onto this form. If you're measuring a waist high garment, you've got to take some additional measurements just of the torso, actually quite basic measurements, but there is a video for that you can refer to. And then if you are including the feet, and certainly if you are including the toes, then you need to use these additional forms here. Now, if you are measuring for a knee high or an anklet or a toe piece, you are going to use those same two forms, the toe measurements and the foot trace, but you have a different form for transferring the measurements, and they are just transferred simply onto this form. Whoops, click that forward. This is where you select what garment, and these are your options and modifications. And of course, you have to choose your fabric and thread colours. That form then gets sent email to customer.service@jobskin.com. And sorry, I didn't have time to choose after the last one, but it should be 0399158000 for the number. We have got lots of support available for you. And we've got a range of resources under the support and training tab on the website, and there's videos on our YouTube channel. And then Veronica in New Zealand, me in Australia, we are available and very willing to help you solve clinical conundrums, give you advice about appropriate compression garments, about prescription. If it's a design challenge, sometimes you, Veronica and or I, plus the design team will put our head together to come up with something. Sometimes if it's just a technical design issue, you're very welcome to speak to the design team. They are awesome at finding solutions. So, and we really do pride ourselves on making ourselves available to help you. So please don't at all feel shy to take us up on that. Just to finish, we've got 4 webinars that are coming up for the rest of the year. We're doing compression for genital oedema. We're doing compression for multi-trauma lower limbs. I think that's going to be a really interesting webinar because we've got some very tricky case studies there. The ANSBAR conference, that's the burns conference for those of you who work in burn and scarring domain, that's coming up in October, and we're sponsors of that conference. It's a hybrid conference, so there'll be some people attending in person, some people attending virtually. So we're still working on how we're going to present at that conference, and we'll make that available to you via webinar. And then we're going to finish the year with a cracker. It's an Ask Me Anything webinar where any challenges that you can bring to our designers, they're going to have to think on their feet. So we're looking forward to that one too. Thank you for joining us today. We hope this is useful for you. We'd love to send you PD certificates for being here. So do let us know your details. And we've probably got, maybe 1 minute if anyone's got a burning question. But honestly, by all means, email questions and we'd be very happy to answer them. Thanks for being with us.
Thanks, Rosemary. That was awesome.
Oh, great. Thank you.